across the vendor table is why we are here, why you are here, and why we're here as MCs. To reimagine a world where the dynamics of power and influence for women are elevated, biases neutralized, and more female investors invest in female founders. This vision of getting to even across the venture table is why we are here, why you are here, and why we're here as MCs. To reimagine a world where the dynamics of power and influence for women are elevated, biases neutralized, and more female investors invest in female founders.
Welcome to the Women's Fast Pitch Midwest region. Wanted to introduce myself, Dr. Sylvia Ma. Thank you for being here. And I am one of the founders of Stella and Stella Foundation and Stella Labs that puts on this wonderful event nationwide across our nation. I want to first and foremost thank our sponsors. First up is Karen Duchesne, a long-term wonderful partner at Cooley, and she has something to say about this wonderful partnership that we have.
Thanks, Sylvia. Once again, Cooley is really happy to be a returning partner in support of the Women's Venture Summit and the Fast Pitch competition in particular. Congratulations to all of the presenters, and thanks to the Women's Venture Summit team who helped make this happen. For those of you who may not know Cooley, we're a global law firm with 1,500 lawyers across the United States, Europe, and Asia. We're best known for representing leading innovators across industries. We rank #1 for representing companies in VC financing transactions. We were ranked as a Startup Emerging Company Law Firm of the Year by the Recorder. We represent more than 40% of Wall Street Journal's billion-dollar company list, sometimes referred to as unicorns. We are just as familiar with working with seed-stage companies as we are with those unicorns. Following the pitches today, my partner Lori Bauer will present on financing trends and terms, and there'll be an opportunity for a short Q&A during the judges' deliberations as well. We're so pleased to support the women's founders participating here today. So thank you again, Stella.
Thanks, Karen, so much. And I know that you put so much of your time and effort into a lot of founders, female founders in our network. So I want to thank you personally as well. Up next, so another sponsor that has been around for a while for us too is the Impact Seat Foundation. At the Impact Seat Foundation, the goal is to close the wealth and opportunity gap. Their full stack philanthropy melds impact investing, grant making, and advocacy to sustain an ecosystem and community for women leaders across the globe. Here's a little video.
Hi, I'm Barbara Clark, founder and board chair of the Impact Seat Foundation, a proud sponsor of the 2022 Women's Venture Summit. At the Impact Seat Foundation, we're creating a world in which women, particularly women of color, can succeed as business leaders. I've been attending the Women's Venture Summit since the beginning, and it's great to see how far it's come. We're honored to be part of this event and to have Stella and the entire Women's Venture Summit team as valued members of our ecosystem. As an impact investor with a career spanning over a decade, I've invested over 60 companies and dozens of funds, all of which are led by women. Now I've donated a large percentage of that portfolio to the foundation so that when these investments are successful, which they will be, they'll further fund our mission. I call this model full stack philanthropy. At the foundation, we want to fortify the ecosystem and close the equity and opportunity gap by offering grants, resources, and webinars. If you're here today, then that means you're a highly innovative and talented business leader. The Impact Seat Foundation is here to support you. On the impactseat.org website, you can access our body of rich resources developed to help you achieve your business goals, such as my new book, Build Your Board, Build Your Business. I wrote this book for people like you who need a board of directors but aren't sure when or how to build one. I want to demystify this process for you because I've seen how an effective board of directors is going to be your secret sauce to success. Let's build a new economy together. And now, on with the show.
Thank you so much, Barbara. And it is about all of us building the female economy. So I love that charge to action. And last is our sponsor, who is more of, our last sponsor is about the judging tech sponsor, Rocket Judge. Perfect. So on with a little bit more about Women's Fast Pitch. We are in our 7th year of doing Women's Fast Pitch. We are here to meet entrepreneurs where they are in the regions that they are at. Right? So we reach out to all of these wonderful ecosystems and say, come on, bring us your female founders. And now we have a virtual competition in 5 regions over 5 weeks. So right now we are in the Midwest. The winner of each of these regions advances to the Women's Venture Summit, which is going to come up in September 16th and 17th here in San Diego. And the winner of the Women's Venture Summit gets a $10,000 investment and about $220K in-kind services. So what a wonderful opportunity. Stella, who leads this, and thank you so much for our sponsors who always support us, is a not-for-profit business accelerator, a constellation where entrepreneurs and investors come together in this wonderful constellation of support. We want to increase representation and funding opportunities for female founders. But please stay tuned until the very end to hear about 3 special announcements that we want to bring as Stella community to you. Now it's time to introduce to you to our wonderful judges. These judges volunteer their time to be here with us. So thank you so much to the judges. First up is Martina Crane. She is an investment associate at Zhou Capital Partners located in Washington, D.C. Martina is passionate about the intersection of breakthrough technologies, which I love, and solving social problems, similar to what Barbara says about impact investing. Incredible. Outside of work, she enjoys volunteering with Achilles International as a guide for disabled athletes, kayaking, and learning new recipes. So thank you so much, Martina, for being part of our judging panel today. Next up is Catherine Gardeau. She is a limited partner in Next Wave Impact Fund, an angel investment group of 99 women from across the U.S. focused on social impact and financial returns. I, as an investment committee member of Next Wave Impact Fund, I loved Catherine's thought process and questions as a limited partner. She provides consulting services through Gardeau Consulting, LLC, and she mentors, I know, wonderfully, university students and sustainable startups in product development, commercialization, and investor relations. Thank you, Catherine B, for being here. Our next judge is Zandra Laskowski. She is a startup consultant with over 25 years of entrepreneurial experience with large multinational tech companies, as well as startups as founder, investor, advisor, board member, and dear colleague. And I say that because she founded OC Angel Investors, a women-focused angel investment group based at the UC Irvine Cove. And because we at Stella at San Diego are so close to Orange County, we have always loved co-investing and syndicating with Zandra's group. Zandra also provides startup consulting, assisting entrepreneurs in producing their startup roadmap. Thanks so much, Zandra, for being here. And last but not least is Brianna Weisinger. She is Assistant Regional Director of the Small Business Development Center, or SBDC for short, where they support 5,000 plus entrepreneurs in the last year and helped raise $300 million for their clients. Just amazing. Brianna identifies as a scrappy intrapreneur who knows how to mobilize support and secure resources to launch, lead, and grow strategic initiatives. I have worked with her side by side, and she is a strategic thinker and also an executor. So I absolutely love working with her. And she focuses on maximizing the organization's capacity while driving business strategy into results. So those are our judges. Thank you so much for spending time with us today and asking the wonderful promotion-focused questions that you will after we hear all of the pitches. So up next is Meet the Founders video to let you know a little bit more about the women pitching today. Wonderful. It's so great to see all of these wonderful founders getting ready, and they have been ready. So the pitching process, when we are seeing all of these 5 wonderful founders pitching, is that they have about 3 minutes to pitch. Then they have Q&A for 5 minutes by the judges. So you know that question and answer period is super important. Questions are supportive, clarifying, or promotion focused so that we can neutralize that bias in this investor space and those founders flourish in that question and answer period. The judging rubric consists of 4 criteria: business model, product market fit, execution, and team, and presentation. So without further ado, I would love to introduce to you our first pitching founder. Just want to make sure she's in the room before I introduce her. Oh, yes, you are. Wonderful. Just wanted to make sure. So first up, and it's very hard to be the first pitching, so congratulations already. It's Claire Zhou of Everyplace Labs.
Oh, can you all see my screen?
Yes, we can, and you have the floor.
Wonderful. Thank you so much. It's nice to meet all of you. My name is Claire. I'm a co-founder and the Chief Operating Officer of Everyplace Labs. We are a company in residence at Fogarty Innovation, a medical device incubator, and a startup health portfolio company. Everyplace Labs is developing a self-service diagnostic kiosk for congregate living and essential work sites. We were initially focused on symptomatic and contact testing for COVID-19 and high contact 24/7 facilities like residential schools and manufacturing plants. These settings provide some COVID-19 testing solutions today, but existing solutions are either vulnerable to intentional or accidental user errors, costly or resource intensive to oversee, or limited to times and places where trained professionals are present. Everyplace Labs offers observed around-the-clock testing that enables automated contact tracing and treatment. The system automatically dispenses test kits, guides users through the testing process, and analyzes tests on the spot. So how does it work? A user completes a COVID-19 assessment form, receives a QR code, and is then directed to a kiosk for testing. The user follows instructions to self-collect a sample and then inserts the sample into the kiosk. They can then leave, and the kiosk will process and analyze the test, sending results to the user in 15 minutes. Contact testing and telehealth follow-up is then initiated. We charge organizations a membership fee per kiosk based on the size of their population and charge on a per test basis. There is no capital equipment cost to the employer or workplace. Everyplace Labs handles everything else from installation to follow-up communications. And we're currently testing our beta system, a functional prototype, in pilots at Illinois Mathematics Science Academy, a residential high school in Illinois, and Namera, a manufacturing plant. And we have strong indicators of system performance, willingness to use, and ease of use. Ultimately, our goal as a company is to enable the shift to hybrid care, supporting test to treat use cases. Our system architecture enables easy expansion to a wide range of existing tests, including tests for other acute illnesses like flu, strep, STDs, drug and alcohol testing, and chronic disease testing. I come from a growth strategy background focused on marketing and innovation. I currently lead a commercial strategy and partnerships. My co-founders, Michael and Prasanth, bring medical device and engineering backgrounds to the team. We are backed by a diverse advisory board with technical, commercial, and medical expertise. And we're currently raising a $1.5 million seed round to advance clinical and commercial milestones, with $345,000 closed and $690,000 raised to date. We invite you to join us in bringing diagnostics every place.
Fantastic job. Thank you so much. And your Q&A, Claire, will be led by Zandra and Martina. So who would like to go first?
I could go first, Sylvia.
Perfect. And Claire, if you're going to continue with your slides, you can keep them up or you can take them down, whatever you feel more comfortable with. Go ahead, Sandra.
Great presentation, Claire. Couple questions. How does the kiosk vet the tester is following the correct steps for the testing and that the sample is not contaminated or coming from like someone else?
Yeah, great question. So one of the parts of our workflow is that we've implemented what we call a digital mirror. So in the digital mirror, the user can watch themselves self-collect their sample while viewing a video feed of an example, a user collecting their sample correctly. So through that, they're able to better follow the correct process or protocol for self-collection. As you know, one of the major issues with rapid tests on the market today is that oftentimes user errors lead to inaccurate results like false negatives. And so our goal is for the digital mirror to avoid those types of issues. We are also planning on implementing an AI that is able to detect that the user is collecting the correct amount of sample in terms of the number of swirls that the user is doing. And we also have a cleaning workflow built into the process as well, so as to avoid contamination between user steps.
Thank you. And second question, who are your partners and what do they provide?
Sure. So one of the key things is that we are not developing our own test strips. So we are partnering with a company that already has an emergency use authorized COVID test on the market. And they also have a very wide portfolio of other tests, which we plan on leveraging for future product expansion. And of course, from a manufacturing perspective, we'll be working with other manufacturers to develop the kiosk themselves, and potentially distributors, particularly in the employer health space and in the PPE distribution space, to get our kiosk into a wider range of locations.
Thank you very much.
Thank you.
I'll echo Xandra's sentiment. Great presentation. Quick questions for you from my side are, first, what level of FDA clearance or are you going to have to seek for your COVID-19 solution or other solutions in the pipeline?
Sure. So we'll be going through the FDA 510K process for our platform. Because the tests that we're using are already emergency use authorized, these tests already have, the test strips themselves have existing data that we can submit as precedent or predicates for our submission, which will be helpful. But we will need to go through testing again as part of our submission package. And longer term, the other tests that we'd be looking to incorporate would also go through the FDA 510K pathway, though we will have leveraged, previous data on the system, the kiosk system itself as a vehicle for those tests.
Amazing. And sort of a follow-on to that is just, what is your sort of go-to-market timeline for each different piece of your product roadmap? So if you see the market is shifting away from COVID and towards something else, how long will it take you to react to that?
Yeah, so we're looking about a year to a year and a half time to market for each of these tests. Again, we're using existing tests that are already on the market. So really the work that's involved is incorporating the test strips into our system, which is built in a modular way to enable that, but also, complete the testing that's required to go through that FDA process.
Amazing. Thanks so much. And again, great presentation.
Thank you.
We have about like 1 more minute. Does anybody have any other questions for Claire? Any other judges?
I can hop in with another one if you like.
Yeah, that would be wonderful. One more.
Sure. So can you just talk a little bit more about your go-to-market strategy, what your key entry point is, and then maybe what your next step is after your first entry point?
Sure. So we're focused on the congregate living and essential worksite space. So we've done quite a bit of, we have quite a bit of proof points in that space, both with the pilot that we have at the manufacturing plant as well as the residential high school. And so for those environments, residential high schools, it's a smaller market, but fairly close knit. One of our investors has a lot of relationships in the residential market space. So that's a really good starting point for us. In the manufacturing space and other essential worksite space, we're hoping to partner with distributors in that space, which would primarily be employer health providers. And as I mentioned earlier, distributors of PPE equipment in those spaces to get to scale our sales.
Wonderful answer. Thank you. Thanks for the judges for wonderful questions. Thanks, Claire. You did fantastic. I always love the Q&A. I always get all jazzed up about all the traction and all the clarification questions and all of that. So I want to also remind the audience as we get to the next pitching wonderful female founder up is that please, as you're watching this wonderful YouTube live stream, like and subscribe below to our YouTube channel at Stella so that you can also do the little bell on the side so that you can get notifications when we do go live again for next week. So like and subscribe in the YouTube, join the community, also chat it up. The chat's probably blowing up down there. So blow it up a little bit more and promote and support these wonderful pitching founders. So let's see, we have next up is, I want to make sure she's here first. Dun, dun, dun. Maybe.
I am. Hi,
Okay,
Sylvia.
yes. Okay. Hi, Jennifer. Okay, good.
Hello.
I have to scroll, so it just takes me a while.
course.
For pitch number 2 is Jennifer Newell of Betty's Co. And I see your screen. You're ready to go.
Wonderful. Thank you. All right. Well, hi, everyone. As Sylvia mentioned, I'm Jennifer Newell. I'm the founder and CEO of Betty's. Now, before I tell you about my company, there's something you should know about me. Here I am at 17, and I hadn't started my period. After one visit with a gynecologist, I was diagnosed with an infertility-causing condition. That was just the beginning. I spent the next 5 years solo navigating a healthcare system that did not serve me as a younger woman well. And after 20 years, not much has changed. These are the words college women use to describe their experiences with a women's health provider. You see, today's options for women's healthcare don't cater to the needs and preferences of younger women. So many put off their care, often to their detriment. There are 20 million females between the ages of 15 and 24 in the US, and they suffer from painful and disruptive periods, common but uncomfortable infections, and mental health conditions at higher rates than just about any other demographic. They deserve better. And that's what we're giving them. Meet Betty's, the next generation of women's healthcare. We start by meeting our customers where they are, delivering care in 2 settings. The first is virtual through a custom digital platform. And the second is in a stylish mobile clinic that we take to colleges, workplaces, and the neighborhoods where women live and play. This hybrid model makes Betty's the most present and accessible option for care on the market. And speaking of our care, we do this a little differently too. We take a team approach and integrate gynecology, mental health, and wellness. And we have redesigned the care experience at every level to enable a 40-minute visit with no wait time. And this experience at Betty's is resonating with our patients. This is evidenced by more than their words. Over the last 4 months, we've experienced 39% month-over-month growth to total more than 220 patients. And a third of our patients make return visit within 3 months. Now, how do we make this work? Well, we're in network with the major insurers and we accept cash pay. You see, our gynecology care captures new patients, but our ongoing counseling and healthy living visits keep them. This provides recurring revenue and at scale presents significant financial opportunities. Which brings us to our current $3 million raise. The funds will be used to position us to serve over 17,000 women and enhance our technology for customer acquisition and retention. We are seeking a strong anchor investor who buys into our mission and wants to come alongside us as we scale. And we have the right team in place to scale Betty's to the next level with experienced clinical, administrative, and technology leadership. Join us as we change how an entire generation experiences women's health. Thank you.
Fantastic job. Wonderful pitch and loved your story up front. I'm going to go see what this is. Okay, so your Q&A will be led by Zandra and Catherine. So yes, go ahead and start.
Okay, great. Great presentation, Jennifer. So really quick question. What do the verticals look like? You have virtual counseling, and then you have the on-site with the mobile clinic. Talk a little bit about what the verticals look like for your revenue model.
Absolutely. So we have our gynecology visits can be done either virtually or in person. Those about 70% of our patients have commercial insurance. And so our average reimbursement rate for those visits is $124. And in the mobile clinic, those margins are right around 33%. And virtually, they're much higher, right? They're going to be around 50%. That's one vertical. Our counseling visits are another vertical. Those are all done virtually. And for commercially reimbursed patients, that margin is about 52% as well. And then our third vertical is what we call healthy living. And so for healthy living for us, that means nutrition, exercise, stress management, and sleep. These are follow-on visits that are shorter that our patients have on a semi-recurring basis. And these are add-ons that are performed by a staff member who's an RN, who's their care coordinator. So anything that we make on those is all profit because that's built into our model. That role already is.
So, and then my second question is kind of two. What is the use of funds for this current raise, and what is your exit strategy?
Yep, absolutely. So we are expanding our mobile clinic presence. We're going to add another mobile clinic, and we are going to expand our geography from San Antonio to also include Austin and then San Marcos, which is a nearby college town, all within a relatively small geographic footprint. We are also going to enhance our technology to add patient decision trees to help them use our services better, as well as a provider portal so that our providers can better engage with our patients. So we're doing that for customer acquisition and retention. We are also adding a B2B salesperson so that we can start going to the institutions that support younger women and sell our services as a benefit for their employees and their students. So we're specifically going to colleges and universities, as well as employers that tend to employ a lot of early careerists. And so we're starting to explore that now. We have a few contracts that are pending, and we want to boost that. So that's where the funds are going.
Thank you.
Exit strategy. Let me answer that as well. Yeah, so we intend to exit in about 5 to 7 years, likely selling to a downstream provider, right? So we are cultivating a community around younger women's healthcare needs to be the trusted source for them. Well, as they age and they start thinking about fertility and pregnancy, or maybe even post that into perimenopause and menopause, they're going to be the primary decision makers for their family's healthcare needs. So we're cultivating this wonderful environment of trust. So that's going to make us very attractive for a downstream provider like an Optum or an HCA or another group like that down the road.
Thank you. Excellent presentation. And I can see that this is a really important place that needs to be addressed. So I'd like to just have you dive a little bit deeper into the trust issue, because coming from another part of the country, there's lots of different, where I live, there's lots of different things going on around women's health and women's reproductive decisions. And how do you develop that trust, and what kind of, how do you make sure that women know that you are trustworthy?
Absolutely.
It's a big
right.
question in a way.
It's a wonderful question. And we're here in the hot zone, right? We're here in Texas, and our growth plans, as we think about scaling nationally, are to go into the Southeast and into the Midwest, where there is a greater need in those parts of the country, fewer resources. We have a significant shortage of OBGYNs here in Texas. There are only 2 OBGYNs per 10,000 women, which is very different when you're in the Northeast and you're on the West Coast. So our model is designed to establish trust with our community here. And we do that in a few different ways. One is we create an inviting environment, both digitally and in person. And so that means online through social media and through our website, we have developed rich and robust content that educates women on their needs. We are very forthcoming in information for them so that as they start to explore women's healthcare and they find Betty's, they can look to that as a resource for them to understand, who we are and what we're about. The second thing is, even in our mobile clinic, in our physical space, we have created a pop-up space where we've curated a small number of products around period care, sexual health and wellness, and fun gifts. So t-shirts, hats, scrunchies, stickers that all have women's empowerment themed information on them. And through that, we are inviting women to come in before they're ever patients. So we are in highly walkable, highly visible locations where we park our mobile unit. And when they pass us by, they can see what we're offering, come in, and we can have a great conversation and start that dialogue.
Well, I like the name Betty's. I think that Betty's, there's a certain amount of trust in Betty's. So
yes,
good luck to you.
Thank you. It's my grandmother's name and my husband's grandmother's name. So
okay. And it looks like Sylvia's popped in, so it gets the floor now.
Yeah, we are done with Q&A. Great job, Jennifer. Thank you, Sandra. Thank you, Catherine. Wonderful learning more about your company, Jennifer. Wonderful job. So as we get the next pitch number 3 up and ready, I wanted to give a little bit of a shout out to Rocket Judge. Rocket Judge is one of the technology sponsor for the Women's Fast Pitch. And Rocket Judge is a flexible judging platform that lets you make your competitions and evaluations more exciting, dynamic, and stress-free. Just add your judges, competitors, and rubric, and watch all the scores roll in. We've used it for many years now. Try a free demo at www.rocketjudge.com today. So up next is pitch number 3, and we are welcoming on stage, just want to make sure I get it. Yes. Jessica Bussert. Yes, I said it right. Jessica Bussert of Wave Therapeutics. So I think that you're up and ready to go. Wonderful, Jessica. Nice seeing you. And then you can share your screen and I'll let you know when that is live.
Thank you, Sylvia, and thank you, the whole Stella team, for putting this together.
And I can see your screen and you're ready to go.
Great. Years ago, I was working in a small town emergency department when a disabled vet arrived with the worst infected bed sores I'd ever seen. He was septic and almost dead. His doctor had prescribed a $4,000 wheelchair cushion to help treat his wounds, but my patient just couldn't afford it. Each year, 3 million Americans will develop a pressure injury, otherwise known as a bed sore, and 60,000 will die as a result. That's 50% more deaths than from car accidents. This space hasn't seen innovation in decades. Current options for care are labor-intensive, ineffective, and grossly overpriced. Wave has developed the first affordable and effective smart cushioning technology to prevent and treat bed sores. Our technology combines two clinically proven therapies, alternating pressure and sequential compression, to eliminate pressure points and actively deliver fresh, oxygenated blood to at-risk tissues. We join this with our smart analytics to deliver real-time data and remote patient monitoring. We'll use our technology in wheelchair cushions, hospital mattresses, and surgical beds. The US healthcare market for cushioning products is over $30 billion. And with our superior technology and significantly better prices, we'll quickly become the standard of care in this important space. We'll next expand into foreign healthcare markets and eventually license our technology for consumer, automotive, and airline applications. Our IP has been filed in the US, Canada, the UK, and the European Union, and our first patent was approved just last month. We've got best-in-class institutional partners teed up for pilots and trials, and we've signed an important contract with the Veterans Health Administration. We've assembled the people to make this all happen. Our core team includes Fortune 100 tech leaders, healthcare professionals, seasoned device engineers, and serial entrepreneurs. Wave is on a mission to end preventable bed sores. Join us.
Great job, Jessica. Love the clear and concise information, and congratulations on that patent.
Thank you. Thank you.
Up next, we have the Q&A by Catherine and Zandra. Catherine or Zandra? I didn't realize.
Yes, I have
I
great
wasn't
questions.
unmuted, so I had to,
Sorry.
I had to unmute.
Catherine, why don't you go first? I'll let you go
Yeah,
first.
great. Thank you. Excellent presentation. And I have to admit, as I was watching that little view of I don't know what to call it, mattress, the therapeutic, I was thinking airplanes, long distance airplane flights. If you could just pick one up at the airport, put it underneath your butt or on your back, imagine how refreshed you would feel when you got off the plane. But I'm curious, why medical markets first?
Well, that's a great question. So long-term care facilities have a real hair on fire problem when it comes to bed sores. So each year, the US economy gets hit by about a $27 billion hit, and most of that comes straight out of the bottom lines of long-term care. So bed sores, if a patient develops a bed sore while in the care of the facility, it's considered to be caused by staff neglect, and the facility is on the hook for any treatment costs. It's also the second leading reason why those facilities get sued for medical malpractice. With our technology, we eliminate that problem completely, giving facilities an almost immediate ROI. But, quite frankly, you've identified some great future future markets for us. And we're looking at developing products for long haul truckers, Uber drivers, office workers, frequent flyers, and many more.
So congratulations on the patent. That is super exciting. So you said the product that's available now is $4,000. Actually, I have two questions. What is the cost of your product? And then is it electric, or how do you make it go?
It's a pneumatic device controlled by its own internal batteries, or you can charge it using a standard cell phone charger. So you can plug it into your car charger or your wall wart or even your powered wheelchair. We've designed our product to have a suggested retail price of $450. So almost a tenth of the more expensive product that we run circles around. And our strategy behind that is, again, with a significantly better technology and a substantially better price, we feel like we're going to quickly become the standard of care and just own the space.
Awesome. Sandra.
Yes, yes. Great questions too. Great presentation. I actually have loved ones that have suffered from bed sores, so I understand the problem for sure. So first question is, how many units per beta site do you plan to test? And really it's a two-part question. And what are the metrics are you going to use to measure outcomes and improvement in the bed sores and not having bed sores?
Well, thank you for the question. So we're actually going to do a rollout of 300 cushions here at the end of this year. And those cushions will be divvied up between pilots, a couple of clinical studies, and 50 early adopter consumers. And we'll use that experience over about a 3 to 6 month period to identify opportunities and challenges and then address those before our broader rollout. Now, I'm sorry, there was a second part of your question and I lost.
Oh yeah, kind of the metrics, because I love that. You're going to kind of give it to a slice of every user. And then what are the metrics you're going to use, or what do you to like really understand the success rate? It's going to prevent bed sores, 90%. It's going to prevent sores, compared to the competition, kind of the metrics you're going to use for the, how effective it is.
Well, we know according to NIA and CDC research that in facilities, 5% of their patient population will develop a significant enough pressure injury to require hospitalization or surgical intervention. And we believe we're going to be able to decimate that number, just slice it into nothingness. So that's our key metric for identifying success. We don't want to treat, we want to prevent the problem from happening in the first place. And with our smart analytics, we also document compliance with care that gives facilities perfect ammunition to protect themselves from frivolous lawsuits. We want the bad actors to be punished, but we want to help the good actors avoid the problem in the first place and protect themselves. So those are key metrics.
That's great answers. That makes a whole lot of sense. And just my last question, what is your commercialization plan?
So our B2B strategy will be selling to facilities direct and also via established distributors. Our B2C is pretty simple. We'll sell again direct through our own e-commerce website and through established DME retailers. But for our B2B customers, we're going to have an added income stream in the form of our analytics platform, which will give us a monthly reoccurring revenue for those customers so they can monitor their patients and collect that compliance with care data.
Awesome job. Wonderful question and answer. Thank you for all your wonderful answers, Jessica, succinct and to the point. So thank you so much. And thank you, Sandra and Catherine, so much. So as we move on to our next things, I knew I was going to mess this up. So give me 1 second. Next up, I just need to get the next up pitching person. Just want to make sure that I'm doing it right. So give me a second. Let's see. when your computer is going super slow and you go faster than the computer, that helps you. And you recognize that, humans can be as quick as computers, but then you need this to come up and then you're waiting. So thank you for your patience as I'm bringing this up again. So that was pitch number 3. And we're going on and my computer is still going super slow. I'm so sorry. Give me 1 second. Just trying to get it going. So yes, thank you so much. My team is amazing to pick me up when everything falls apart. So up next is Pinkey Patel from Myra Health. So Pinkey, I know that you're up and see if you are ready to go. Oh, yes, you are. Thank you, Pinkey. And you can share your screen.
Awesome. Thank you so much. Let me know whenever ready to go.
Let's see if it's going on. And you're up and running.
Awesome. Hi, I'm Dr. Pinkey Patel, the CEO and the founder of Myra Health. We've built the only all-in-one evidence-based postpartum app and community moms need. Pregnancy is viewed as a very glowy experience with ample resources. Someone is holding your hand daily until delivery. Imagine jumping off a cliff while someone's holding your hand, but they let go halfway and you end up at the bottom alone. The average time between delivery and the first postpartum visit is 6 weeks. 40% of women don't even make it here. After 6 weeks of sedentary living and navigating one of the most profound shifts a woman can experience, we're cleared to resume activity. 9 months of readjusting organs can't be solved in one 11-minute appointment. 95% of women experience a type of physiological issue that actually impedes their quality of life. The Myra Health app is an evidence-based tool that has been reviewed by gynecologists and physical therapists. The rehab techniques are specific to each mom's type of delivery. The app features time-released articles that provide weekly insights for both mom and baby. I hold a doctorate in pharmacy and I'm a certified pre- and postnatal fitness instructor. I had such a challenging postpartum experience that was compelled to create a solution that would support every mother after me. The first image on the left is what society thinks postpartum looks like, and the second image is what it really looks like, isolating. When the mom has a baby, she can immediately download the app and it curates her experience based on how she delivered, instead of leaving the hospital empty-handed. We equip our moms during the most vulnerable times. 3.8 million babies were born in the US alone last year. Birthing moms spend an average of $3,100 in their first year postpartum on their own health. Our total addressable market includes postpartum moms with an average income of $40,000 or above. Our subscription-based revenue model consists of 3 opportunities. Employers are eager to ensure their new moms return to work in a more supported capacity. These are our current pilots. We plan to expand into other B2B experiences as there has been a substantial appetite from employers. An example of a TPA is Forma. Forma has been our client on our MVP, and they provide employers a modern benefits platform. We serve a number of employers, including the ones that you see here on our current MVP. In 23 months of an entirely organic outreach, we've generated over 6 figures in revenue, and we've seen paid downloads globally. We are anchored in community, and users spend an average of 15 minutes in the app daily, and they're extremely engaged in our social media communities. Joshma is our marketing lead, and Devin is our technology advisor and assist as we navigate scaling our technologies and our team. As a primarily women-led team, we're looking to expand as we are in final negotiations to bring on a medical advisory board. We are raising $1 million on a safe note, and we plan to accomplish the following here. We're not only capital efficient, but we are recommended and have repeat mothers. The world creates tech for the future. It's time we create tech for moms who birth the future. Thank you.
Sorry, Pinkey. Wonderful job. You did fantastic, very clear about your company and your traction. So well done. Your Q&A will be led by Martina and Brianna. Who would like to go first?
I think the hosts have to turn back on our videos.
Perfect. Brianna, you want to go
Hi,
first?
Pinky.
Hello.
Yeah, my video's on, so can you hear me?
Yep, I can hear you.
Okay, perfect. Congratulations on getting to this point, Pinky. Excellent job on your presentation, your pitch. I appreciate the efforts that you're putting in. I've been one of those moms, so I know what it feels like. I'd like you to talk, if you can, a little bit more about the funding that you're raising and what you expect to achieve with it. That slide flew by really quickly for me, so if you could go into that a little bit more in detail, I'd appreciate it.
Yeah, so this is the slide that I'm sharing my screen right now. So up until now, we've organically acquired our users. So we said that community has been our catalyst. We launched that prior to launching the app globally in 166 countries. And I was actually working full time and pregnant with a toddler in my ear. So up until now, it's been a very lean team. So that's why we're proud about being capital efficient. But now we're trying to establish and moving out of the MVP, right? So really moving our funding towards ramping up and optimizing our technology. So establishing our B2B partnerships, getting our key high-level hires, including a CTO, and becoming HSA and FSA accessible, and expanding our in-app content and LTV. So whenever I talk about on this slide, I didn't present this slide, but this is on our appendices. We talk about utilizing this capital over 12 months and in phases. So building out our team. We've done this rebrand. We were formerly the SnapBack. We just rebranded over to Myri Health. And then now we're kind of establishing further partnerships. And then we'll actually optimize our technology and expand the LTV. So I'm still support. And I've known that over the 2 years that the first thing moms say is, hey, I didn't do anything for my pelvic floor. I'm 24 months postpartum. What can you do for me? So really optimizing the app to increase our LTV. And you can see as in phase 4, how we plan to monetize on that.
Excellent, thank you. And I just have one more follow-up question. Can you discuss a little bit about key metrics and success? What does that look like for you? How are you going to measure the shift in the quality of postpartum care and addressing women's needs once they've adopted and hopefully maintained their use of this app?
Yeah, absolutely. So the number one metric that I want to improve is reducing our churn rate, right? So right now, obviously, I've identified that we've got rehab and recovery techniques that have been working for mothers for the past 2 years. So being on this MVP, I've been able to pull data, qualitative and quantitative data. So I'm able to tell, when did they drop off? Why did they drop off? So my number one metric is our in-app community engagement, and to see how can I further keep the mother on the app and improve outcomes for them in terms of pelvic health and long-term community. We just launched announced our partnership with BetterHelp as well. They're the largest mental health platform. So integrating solutions like that as well, because we'd like to kind of call ourselves an all-in-one postpartum assistant. But our number one metric will be to reduce our churn rate and increase our LTV and increase our engagement within our app.
Excellent, thank you.
Great presentation. Thank you so much for sharing. I know that the maternal health desert is real in a lot of places in the US. So a quick question that I think is a little bit following on to Brianna is, have you conducted any sort of clinical trials or shown sort of the level of efficacy for the beta users that you have?
Yeah, so that's something that we plan on accomplishing as we kind of close this round of funding and we increase our team structure. It's certainly been in our minds as I built the infrastructure of the app. So in the app, as the user is experiencing it right now in our MVP, every 2 to 4 weeks, we've been collecting qualitative and quantitative data to evaluate to see, have we accomplished in preventing diastasis recti and improving pelvic floor outcomes. I am not obviously conducting a clinical study, but I can utilize those metrics to further secure other contracts with B2B enterprises and employers. And in our next phase, I do plan on bringing in a little bit more of that clinical aspect so we can further validate our outcomes. And as a pharmacist myself, it's like it's in the DNA of, in the science of my background to conduct a study. And I'm really glad you asked that question.
Yeah, no, I've seen I oftentimes see that these extra steps are taken for companies like this, even though you don't need FDA approval. It's still great to see that sort of validation. And then I think just to understand, do you have, what is your current traction in terms of ARR, and kind of how is kind of customer acquisition going?
So in terms of acquisition, we started D2C, right? That the community, whenever I mentioned the community being a catalyst to our traction to date, it's been strictly through social media and acquiring the trust of our healthcare professionals. So before we asked for a single dollar, we really leaned into that. And currently kind of driving that D2C traction that has been like you can see here, our monthly active users are about 3,600. We've been trending around without a single marketing or ad spend, aside from like a 4-week ad campaign that we did to test CAC to LTV ratios. It's been around 4,000 to 5,000 a month without pushing any type of marketing or ad spend. I'd like to say that we've kind of slowed down to speed up, if you will. So after finishing the plug and play accelerator in Silicon Valley, end of last year, we were approached by employers. And that's when I decided, and I used to work for a large employer and I knew that there was a gap there, which is where kind of the solution came to mind. But they started having an appetite for mothers because they realized that they weren't providing solutions postpartum. So that's when, we haven't been aggressively tackling D2C. We're kind of slowing down to speed up in the sense of acquiring more B2B contracts. So it's been trending pretty steady.
Okay. And how is that initial B2B process going for you?
Whenever I pulled up this B2B slide, so initially when we were approached by larger enterprises, that sales cycle is longer and there's a different learning curve there. But the third-party administrators, like you see Twig, they're now known as Forma. There's a lot of those out there, right? So we performed a pilot with them and we still have a contract with them right now. They're basically a modern benefits platform, so they're easier to permeate, but they serve employers like Lululemon, Zoom, Stripe. And so that has been successful from the angle that I've been able to permeate these entities, but I'm still navigating the larger sales cycle. And that's what this funding will do. It will allow us to bring in experts to fill in those gaps.
Thank you so much. Wonderful answers. Thank you for all the questions. Sorry, I have to cut it off, but Martina, Brianna, thank you so much for such wonderful questions.
Thank you.
So up next is our wonderful last pitch of the afternoon. But before we start, I just wanted to make sure that everybody knows, kind of follow us on social media at Stella. And we are Women's Venture Summit, WVS, on Instagram and LinkedIn and Facebook. We are here to be a resource to you. So connect with us. And our sister organization at Astra Ventures has boot camps for founders and investors throughout the year. So just know that go on their website and find out more information. It's super exciting to be part of this larger constellation of co-investors and syndication partners and women and investors who really care about equality. So last but not least is our last Midwest. I want to make sure she's in. Yes, Teri, wonderful. So last in is Teri Sirset of DASI Simulations.
Yep. Thank you. Thank you, guys. Let me share my screen.
Yeah, I'll let you know when it's on.
Alrighty.
And you're sharing and you're ready to go.
Excellent. Thank you so much, everybody. This is the second time I've been able to do this. I really, really appreciate everybody's support. My name is Teri Sirset. I'm the co-founder and CEO of DASI Simulations, which is a SaaS-based med tech company positioned right at the intersection of personalized medicine, healthcare, and IT. So by utilizing, sorry, we are not advancing. Okay, there we go. By utilizing artificial intelligence and computer vision for pre-surgical planning, DASI is committed to the lifelong planning and complication reductions for patients with heart valve disease by providing personalized predictive modeling solutions. So heart valve disease is when one or more of the valves in your heart don't work correctly. Over 11 million people will have heart valve disease. 1 in 2 patients over the age of 65 have it. It's undetected. And if left untreated, most will die within about 2 years. So unfortunately, my father was one of those. So this journey for me is extremely personal. This is a fast growing market with $4.2 billion in simulation alone. We are surrounded by an amazing executive team with over 150 years of experience, including exits to very large companies like Baxter, Cardinal Health, Medtronic, and Boston Scientific. And what is the problem that we are trying to accomplish? I apologize. So right now, the pre-surgical planning lacks very great sophistication and AI-driven solutions. So what you're seeing there in the black and white is just basic measurements off of a patient's CAT scan. Those measurements go into a heart team meeting where the heart team pre-plans a patient's surgical procedure. It's very subjective. It often is based on the experience of the physician. It's manual, it's time consuming, there's no customization. And that leads to between 20 and 30% complications. One which can be death. It is not reimbursable for hospitals if a patient has to come in within the first 30 days to have a repeat intervention. Center ratings go down and there's absolutely no lifelong planning for those patients. What you're seeing on the top is what we call the current status quo. So based off of this black and white image that was measured, what you're seeing here on the right are the last few beats of a patient's heart, because this patient had a root rupture. And you'll see the contrast dye come out right here. So this patient actually died on the table. And what we are providing is a solution that we call the DASI advantage. And what you're seeing down here in the red and yellow is the case that if it were given to us retrospectively, we would have been able to determine that the small pointy nodule right here, the calcification, would have indeed ruptured that root, and the physician would have been able to save that patient's life. We do it very easily by taking a patient's CAT scan. We run it through a portal, we upload it. We run it through our proprietary algorithms, which are HIPAA compliant. The report is generated and professionally checked. It goes back through the portal and the physician is able to download it. Right now, as I mentioned earlier, we have a very large market with a TAM of 4.2 and a service addressable market of 125, highly scalable SaaS model with attractive margins of 90% or more. We just got a patent issued on this July 17th of this year, and we have 7 more patents filed from Ohio State University and Georgia Institute of Technology. We have immediate market entry with a well-defined regulatory and reimbursement pathway. We're an Ohio-based company, exclusive license agreements with OSU and Georgia Tech. We are currently revenue generating. We've received over now up to $600,000 in non-dilutive funding from the state of Ohio and Rev1 Ventures. We have an excellent commercialization strategy. We're working with 22 premier structural heart programs, centers including Northwestern, Baylor Scott and Women's down in Plano, Texas, Brigham and Women's, Cedars-Sinai. We have a well-established clinical opinion leader group, and we have 8 filed patents right now. Clear path to FDA strategy and reimbursement, and we are currently in the market utilizing over 31 independent sales representatives. So what we're looking for right now is last year we are oversubscribed on a note at 1.75. But we've decided that we have several key milestones that we intend to hit by Q2 of 2023. So it didn't make sense for us to raise a Series A. So we've opted for a bridge to Series A. We're raising up to $3 million with the ability to oversubscribe to 5 on a 2-year convertible note with a 5% interest and 20% discount. And this will go towards continued headcount, regulatory and reimbursement, and continued filing of our IP.
Thanks, Teri. You're out of time. So sorry.
No worries.
So up next is just the Q&A period of it. Mm-hmm. So you have 2 very good Q&A leads. So Martina and Brianna, would you like to start?
Hi, Teri. Thank you for your presentation. Congratulations. You're doing excellent work here. It looks very exciting. So I appreciate your efforts. So I want to give you a little bit of an opportunity. Can you talk to me about your team and what they have that's going to help facilitate you in this pathway towards the market and growth?
Absolutely. Right. We have our COO is Sean McGibbon, and he comes to us from the internal hospital system as a former CEO and past president of a few hospital systems within the state of Ohio. Kent Smith is our senior advisor, and he has had amazing exits to companies like Hologic Women's Imaging and Corvita. Dr. DASI is the CTO and inventor of the technology with over 15 years experience in this space. And Rich Gray, who has been in the same cardiovascular area that I have been in, actually, with over 25 years of extensive experience, also with 4 really large exits to Baxter and Cardinal Health.
Excellent. Thank you. I appreciate that. It looks like you've put together a quality team with great experience in building companies. My next question is really around your regulatory pathway and kind of how you see that playing out over the next 3 years.
Excellent question. Right now, we're in the market under the 21st Century Cures Act, which is an umbrella that the FDA has put companies such as ours, which were considered a non-medical device decision support software tool. And we have actively gone to the FDA. We have 2 510Ks that we are submitting. We expect approval by the end of the year on both of those. And then that will lead us to our reimbursement strategy, because you can't get reimbursement without 510K approval. And so we have a very well-defined, we're working with a large CRO and a consultant called JD Lyman that is helping us with our reimbursement strategy.
Thank you.
You're welcome.
Great presentation, and also great questions, Brianna, because I think I had exactly the same ones top of mind. If you could talk us a little bit more through your sort of go-to-market strategy and kind of what you're facing in terms of your sales cycle right now.
So our sales cycle is about 5 months. It will get shorter as we move along. We are breakthrough technology, first to market, greenfield advantage, call it whatever you'd like to call it, but we are disrupting the status quo. So with this very disruptive technology, we are changing the mindset of how things are currently done right now. So our go-to-market strategy has actually been very organic growth by physicians. We've been able to attend many well-known trade shows, American College of Cardiology, TCT, TBT, and just through word of mouth, the physicians are spreading the technology for us, which is unusual. I have a sales background, unusual for that to happen. But we did establish a relationship with Rich, who I had said is our VP of sales, and he's part of a distributor network across the United States. And he has tapped into the distributor network, which they have the same call points that we do. And so we have signed on, by September, we will have signed on 37 independent sales reps that are now starting to move across the United States. We've strategically placed them in areas where there are large centers, and they are getting the word out. And then again, through physician word of mouth, we've really made quite an impact this year.
Amazing. And then my next question is sort of, actually, I have 2 top of mind, I guess. One is, how are you building your data sets and continuing to refine them? And like, what is your general source of data?
When you say data set, are you referring to FDA data, or are you referring to sales data?
Sure. So I know that you're an AI-enabled platform, so the data sets that you're building your AI on.
Okay. You know, that's a very good question. So with what we're doing, we're not typical AI. We are actually a physics-driven AI, so we don't need thousands and thousands of data sets to build that AI platform, because we're centered more around a 3-part process where we actually do a physical 3D rendering within the system, and then that goes into the simulations. Our AI is built that way, so we don't need as many, let's say, for example, CAT scans to be able to verify and validate the technology.
Amazing. Thank you for your time.
Welcome.
Wonderful conversation. Thanks for those great questions. Both of you guys rocked it. Wow, I love it. So thank you so much, Teri, for closing us out today in the Midwest of the women's fast pitch. So very exciting. Now it's a little bit of a change, right? So now the judges go into judges deliberation. You, the audience, need to do audience choice. And then the audience gets to have a wonderful talk with one of the partners at Cooley. So just like an amazing next set of things in this wonderful event. So as the judges deliberate, and reminder for the judges out there to keep your screens on. So you have to go back on video so that you can go off and go into that room. And then time to vote for the audience. So the audience choice, you're going to see the link in the chat box below on YouTube, or visit Slido, SLIDO.com with number 54672. So with that, you can take your audience choice. It's always beautiful and wonderful for those female founders to actually get the audience choice recognition, because that really means a lot to them. So, and then before I go in to do the judges deliberation and go into the room with them, I want to introduce you to Lori Bauer. She is a partner at Cooley. She's the co-founder of Cooley's Chicago office, hence the Midwest, and the co-head of the Chicago corporate group. Her practice focuses on the representation of emerging and growth stage companies and the investors who support them. Today, she will be talking about financing trends and terms. So Lori, welcome to the floor. You're going to have Karen to also walk you through a little bit of the Q&A, and I'm going to disappear for a little bit and come back when you are all done with your wonderful talk. Thank you, Lori, so much.
Great, thank you. Let me just share. Can you all hear me?
We can hear you. Yep.
Okay, great. Are you able to see my presentation?
No.
Give me 1 second. Maybe while we're working on getting the slides going, I can just get started with some discussion around two things that we wanted to cover today. The first one is relates to the state of the venture capital market. I think on top of a lot of people's minds is the macro environment and what does that mean for people that are looking to go raise money today. We know that the capital markets are in a state currently that is not as favorable as we have enjoyed for the last several years, and including all the way through 2021. For example, Cooley handled 332 disclosable venture capital financing deals in the last quarter, representing 16.6 billion of invested capital. Both of those numbers are down from the first quarter of 2022 and down from the quarter before that. So I think, you know, we are seeing a tightening in terms of the number of deals as well as the total dollars invested. I think, so that's, you know, one thing to put out there that not surprisingly, even, you know, just within the deals that Cooley has worked on, we're seeing those trends. However, I think the interesting thing, and we talk about this quite frequently, of course, as we try to track the markets and help our clients, both on the investor side and company side, think through, well, what does that mean for fundraising at all stages. I would say that in terms of the early stage venture deals, the median pre-money valuations declined somewhat, although not as great as sort of the later stage rounds. So, and they were still high compared to valuations from, call it, early 2021. So just, for this group, again, with some earlier stage founders, people are oftentimes just interested in like, how do I think about valuation and what's series I'm on, or how do I think about that? And, for there, maybe we can progress the slides. I think we have a couple of slides that show trends year over year and quarter over quarter. But the Series C deals had a pre-money valuation median of $17.1 million, with Series A deals with a median valuation of $60 million through June of 2022. So those are still very healthy numbers, and still up at historic highs, just not through really the peaks that we saw in late 2021. Similarly, although slightly down from the highs in the late 2021 and early 2022, medians for Series B deals are still quite high, around 164.4 million for June of 2022. So we definitely saw a high in the prior quarters, but I think especially for early stage companies that are going out to raise, we're still seeing those deals get funded, and we're still seeing founders get strong valuations. It's not quite as we were using the words frenzied and frothy as it relates to deals and founders getting multiple term sheets and really being in the driver's seat. I think it is still a friendly market to go raise at an early stage, but with some of the discipline, I think, coming back from investors. So thought it would be interesting to just cover some of those state of the market type of topics. And the next thing we wanted to just talk through are some of the common terms and that come up in earlier stage Series A, Series Seed financings, and areas where founders sometimes, especially first-time founders, if you haven't done this before, can get tripped up when you're dealing with term sheets that come in from investors who write the term sheets, understand exactly what they mean. And so wanted to just run through a quick set of high-level terms. So this slide, thank you for progressing us. Valuation, of course, is front and center in any financing, and is usually the top line item in a term sheet. In the next slide, we'll get into a little bit more detail, but it's important to understand anytime we're talking about valuation, what does that mean? Is it pre-money? Is it post-money? And how that relates to dilution, because that's really all that valuation is. So we'll get into that a little more, but that's, of course, the headline for any term sheet, and something that was really important for all founders to understand when they're trying to evaluate a term sheet. But other key issues include your board of directors, who's going to control the company, what are liquidation preferences, what does that mean in an exit scenario? And, as an aside there, those liquidation preferences really only matter in a downturn. And if you're selling for less than the amount that has been funded to the company, and sometimes in those situations, founders can be surprised as to how that works. And so equipping yourself to understand just what that means is important. Option pool size, how investors think about having an option pool and what % of that needs to be unallocated in their view. If you get asked to revest or vest for the first time your shares. So those are some of the key issues. And then just one thing wanted to note, the financing documents that Cooley uses in our deals are publicly available on cooleygo.com. It's also a great website where all of those statistics that I was just reciting at the beginning of this and the actual charts that were included in this presentation are all publicly available there. So if you are thinking about raising and want to do some studying up on your own just to understand the current state of the market, as well as lots of posts from different of our attorneys here on these topics and many, many more, you can go and click around there. There's a ton of great content. But this last point on this slide, I think is a really good one, which is, make sure that you understand the terms, even if you don't understand every point in the documents and to make sure you've got counsel or experienced next to you to help you get through the negotiation. Maybe next slide, please. Thank you. So again, as I mentioned, valuation is hugely important, not just because it means, well, someone has validated your business and given you a set of evaluation out there that shows that what you've built is worth, whatever number it is that they've ascribed to it. Really, what's important about the valuation that's given is that will be the thing that dictates how much of the company you give away for whatever amount is invested by the investor. So that's what this first bullet point says, is basically what the pre-money valuation does is it sets the purchase price per share for the shares that you're going to sell. And the way, maybe we could just go back one slide, please. So the per share price for each financing is calculated by taking the pre-money valuation, dividing that by the shares that are outstanding. So we call that the pre-money capitalization. So if people talk about shares being included in the pre-money, that's basically comparing apples to apples, which is pre-money valuation and pre-money capitalization. So, an easy example of this is just to say, if you have 10 shares outstanding and you're valued at $10, you're going to sell the next shares for $1 per share. It's just as simple as that. So that's the way to think about pre-money. The thing you need to also keep in mind is that an investor is going to say, well, you're fully diluted capitalization, which means that you've included in that. And for early stage companies, the thing to keep in mind is your option pool and how many shares in your option pool that you have not yet issued will go into your pre-money capitalization. So if you have 10 shares and 2 outstanding and 2 shares unallocated, it's actually going to be 10 divided by 12 or 12 divided by 10, the opposite, sorry. And it's going to give you less than $1 a share, which means they're going to get more of the company for every dollar that they spend, meaning that you are taking the dilution from your unallocated option pool. So it's really just pretty simple math, notwithstanding that I just stumble over how to talk about it. But it all of this in terms of the amount of the company that you're going to give away is really just straightforward math. And the key, I think, to making sure that you don't end up with an unintended outcome is that you really just understand how the math works and have worked through it in an Excel spreadsheet or other mechanism. Excel is what we typically use to run through what does that actually mean. So I think next slide quickly, please, would be the post-money valuation. And this is the one thing to keep in mind is that, and this is how investors think about the company. So they're thinking about, okay, if I'm going to give you $1, I'm going to invest $1, and following that, I'm going to own 10% of the company. That means the post-money valuation needs to be $10 million. And the post-money is pre-money plus money invested. So that would be a pre of 9 plus the money in equals post of 10 in order for them to come up and own 10% on a post-money basis. So, and that will also include your option pool and anything else, including, I think probably relevant for this group, is that you need to be clear about whether safes and convertible notes are also included in that post-money, their assumption of what is in the capitalization in the post-money, in order to ensure that you're not sort of talking past one another. Because what can happen, and I've seen it happen, is founders assume they hear a number and they assume that the post is going to reflect this pre-money that is just the post minus the new money in, but they fail to understand all of the additional dilution that comes from an option pool, converting notes and converting safes. So I know some of the companies that we just heard, are raising safes and notes today, you have to make sure that you understand how an investor is expecting those dollars to count towards the post money, as well as any discounts or caps and the impact that those will have. And so I think value, and I probably used up most of my time here, I see Karen, on talking about this, but I think if, one thing you take away from this, it's to really just read up on that and understand some of the basics. And then, working with counsel, of course, we can always help you run through those iterations, but that's a very core thing to understand going into a financing. The next slide, just talking about the board, I think, these are somewhat more straightforward, but, the size of the board, probably coming out of an initial seed or series A, even you probably will have either a 3-person board or maybe a 5-person board. Typically, they're not an even number. Sometimes they are. And just paying attention to, and typically those are decided by majority vote. So understanding if you're giving away too many board seats, I think that's the thing for founders to keep in mind, that if a lot of people want board seats, and again, a lot, maybe even just 2, if it's just you, and now you've given away 2 board seats, in order to retain control, you have to have 3 people, you plus 2 others, in order for the common stock to control the board. So just keeping in mind and being judicious about how you think about who gets a board seat, and what that means for dynamics, because once you have an investor on your board, you do have a voice with power to help make decisions and steer the strategy and future of the company in a way that you did not have before these investors came on to your board. Liquidation preference. I think all that I would say about this is that this is not really something that you can negotiate. Every single venture deal the investors will have a liquidation preference. And what that means is that if somebody puts in $10 and you sell the company for $9, they get all 9 of those dollars. So that's a way that investors protect themselves. So if they put in, $10 and you sell for $100, they don't get that liquidation preference. But in a downside scenario, they will get 100% of their dollars back before the common starts participating in anything. So that greater of, like I said, they should not get that liquidation preference, as well as be treated like common stock. And those are other varieties that we've talked about here, which are fully participating. Or sometimes, we say here, what do you mean more than 1x? Sometimes they may say, well, I don't just get my $10 back, I get $15 back before anybody else starts participating. I have not seen these types of liquidation preference terms really showing in deals that I've worked on, but these are the types of terms that may start showing up in a down economy. And that those of us who've been doing this for a while have seen them, and they can make a difference. So I think this is just an area where, in an up cycle, this is really not something we talk about a lot, but in a down to flat, where people are feeling a little bit more that they're taking a risk, these are things to look out for, and just to really make sure that you understand what it is you've agreed to, and are able to weigh it. Option pools and revesting. So, option pools are probably something most founders are familiar with, the fact that you need to have an option pool and be able to issue stock options to folks that are coming to work for you. That can be used as a compensation tool in lieu of cash when cash is short. So I think the thing to keep in mind is that investors are going to, a point that gets negotiated is that an investor is going to say, I want to see at least X% of your fully diluted capitalization in your pre-money. Again, then that's what's used to calculate purchase price, which then feeds directly into how much of the company they get. Lower purchase price means more of the company for the same dollars than a higher purchase price does. So it's really just a negotiation around how much of the company should be represented by unallocated pool. And I think the second bullet point is really great advice, and something I always tell people is they're going to push higher, oftentimes. And if you don't think you need to have 15% available, if you're able to show a budget for who your hires are and how much of the company you think they're going to get, and support the percent, as opposed to it just being, they say they want 15 and you want 5. And let's try and settle at 10. If you say, no, I really only need 5, and this is why, that's a lot more powerful than just negotiating it as a number and thinking about it as just how much dilution am I going to take, although that is a result of it. The one other thing is, vesting and revesting. And so sometimes founders are surprised by this. Term sheets will say that the founders their stock needs to be at least X percent unvested, maybe 50%. So your stock is not subject to vesting at all today. And then all of a sudden, an investor may say, well, no, we want at least half of your shares to be at risk, such that if you leave the company, you would forfeit that ownership. And that's obviously hits really close to home to founders. And so something that is important to understand. I would say it is not an off-market ask, but there are, it's important to understand what it means, understand, sort of leverage of both sides and why they're asking for it, to get a better sense of what you're agreeing to and whether it's fair or not and worth doing. These are super important terms to a lot of investors, and not something that's uncommonly requested. So I think, how much of your shares need to be vested and what the triggers for acceleration are things to talk to your counsel about and just really understand what it means. Again, that's most of this is understanding it, because the investors really, they do this for their jobs full time, and they think about these terms all the time, whereas founders are, running their businesses and trying to do this. So having somebody that does this also for a living, it's your counsel, that's the role that we play, or other trusted advisors to help you understand where to push back. What does it actually mean? What leverage do I have, so that you're not surprised, when you get to signing and there's a hiccup because you didn't really just understand what it was that they were asking for.
Thank you, Lori, so much. I know that Cooley does such a great job of educating. I love Cooley Go as well. And sitting beside your founders, making sure that they really understand it, not just transactionally, but really relationally, sit down with them so that they understand all of their options. So thank you, Lori, so much for joining us today as a
pleasure.
leader
Thank you.
in the Midwest.
Thank you.
Yeah, thanks, Lori, so much. So we have all had the judges' deliberation. We've had a wonderful presentation from Lori. We're really excited to close out today as the Women's Fast Pitch Midwest region. And I just want to say this region is very dear to me personally, because when we started Women's Fast Pitch 2 years ago, we had only a handful of applications. And those applications said, we really need Stella in the Midwest. So we kept on persevering, and now 2 years later that we had over 25 applications in this region alone. So that's why the competition was hard, was amazing. Female founders who pitched, thanks for coming back in. You are all amazing. Pitches were extraordinarily well executed, communicated, and presented. So well done. And I am here to present the Women's Fast Pitch Midwest winner. Thank you, judges, for being so open to letting me know who would be the winner. So without further ado, little drum roll. Women's Fast Pitch winner of the Midwest is Wave Therapeutics. So Jessica, would you like to give 2 or 3 sentences?
Thank you all so much. Oh my gosh. I love winning a pitch event, but especially when the competition is so incredible as the other women that spoke today. You all have incredible products. And if I were an investor, I'd be writing checks to you all. So thank you so much. And thank you for everybody for the great support.
Thanks, Jessica, so much. And the Women's Fast Pitch Audience Choice winner is DASI Simulations. So congratulations, Teri, for winning the audience choice.
Thank you. Thank you very much. I appreciate it.
Thanks, Teri, so much. So that concludes a part of the pitching. Founders, I wanted to just remember those 3 announcements that I told you about way at the beginning? I know it's like really hard when you're hearing all of these wonderful pitches, but announcement number 1 is calling all accredited investors. We've set up special purpose vehicles for all of the Women's Fast Pitch participants who are actively raising rounds. So if you are interested, you have registered for the event as an accredited investor, you will automatically receive a follow-up from our team with possible next steps. So announcement number 2 is that Women's Venture Summit. It's coming September 16th, 17th. It's like Christmas to me. I love it. I want to see you there. It's super exciting. It's definitely an experience. It is not just an event. It's an experience with investors and entrepreneurs that are willing to really take a impact seat, let's say, in the equity space. So find out who wins the Women's Fast Pitch Finals. We are in person again, finally, after COVID. So come on out, help. It's held at the beautiful Town and Country Resort, just about 15 minutes away from the San Diego International Airport. And what's cool about this event is that it's in Town and Country. This is our first time coming out of a university. So help us by buying your tickets. And also you can get groups of tickets. So come with your friends. If you're a small angel group or a dinner date group, come. There are group discounts as well. You can get 4 for the price of 5. So exciting. There is engaging programming that's specifically curated for everyone, founders, investors, men, community partners, and so far. So share the promo code and making sure that you share with yourself, with all of your wonderful community members, WFP to WVS. So Women's Fast Pitch 2, the number 2, Women's Venture Summit. So audience, please know that it's there. Please use it. And you can get 15% off all ticket types. Don't hesitate to register. Some breakout sessions do have limited seating, so let us know prior to. Announcement number 3, almost done. So Stella Labs, which is our business accelerator who's been around for about 8 years. We have our Spring 2022 cohort demo day is September 1st. These ladies have worked so hard for the last 12 weeks in launching and scaling their businesses. So we're super excited to bring them to you. It's a similar type of a presentation like this, but man, have they met their milestones and just gone through them. Another free event just like this. So make sure that you come and you subscribe to our email communications and follow us on social media to ensure you are notified of all the events that we host, and we would love to see you at Demo Day. So thank you so much. In closing, to our founders, you all did such an amazing job. To our judges, thank you so much for volunteering your time. And if you do write a check, thank you so much. And thank you to our sponsors, Cooley, the Impact Seat Foundation, and Rocket Judge. Join us next week for Women's Fast Pitch Northwest on August 23rd at 3 p.m. Pacific Standard Time. See you there.